subscribe now and press the bell icon. Never miss an update.
Hello and welcome to Health Live at Seniors today. We are delighted to have here with us Dr. Hemalata Arora, and she is going to be speaking to us on adult immunization. A little about Dr. Arora. She is a very senior internal medicine specialist, nearly 25 years of experience, and MBBS from GS Medical College that I've just got to know, MD and DNB in medicine. She is certified and recertified in 2009 and 2019 by the American Board of Internal Medicine. She is a senior consultant at the Nanavati Max Super Speciality Hospital and was head of department of internal medicine at the Seven Hills Hospital in Mumbai. She received the coveted Paul Bunn Award for the most promising activity in the field of infectious diseases, awarded by the Suny Upstate Medical University in New York. Welcome to Health Live at Seniors today, Dr. Arora.
Thank you very much. Thank you very much for that kind introduction.
You know, I was what led me to having this session was a few weeks back, somebody suggested to me that, you know, I must take a shingles vaccination. And, you know, I was wondering why a shingles thing. I'd never heard about it, or I had heard about it, but I didn't realize that, you know, it was so important to take. And then, of course, I, you know, looked at, I spoke to a few people, and they did tell me about the fact that they had taken it 5-6 years back, and the need to do it. And then, of course, one had heard about the various vaccinations that are there. At the time of the COVID pandemic, there was this whole thing that, you know, if you've taken a flu vaccine, then should you space it out? And that's a question that we asked quite a few doctors, especially the internal medicine specialists. And then, of course, this discussion about the various types of immunization options available for adults. And that's why we have you over here to speak about it and to inform our readers here about it. But first off, you know, since you are internal medicine handling that stream at Nanavati Hospital, what is the scene currently at the hospital on COVID?
It has, of course, the case numbers have significantly increased as compared to, let's say, 2 weeks ago. These last 2 weeks have seen an exponential rise, albeit the number of admissions are not that many this time around. I think the panic is also much, much less. Everybody's understood that, you know, having had been vaccinated 2-3 times, the symptoms are rather mild, almost asymptomatic, and they kind of most people recover within about 3 to 4 days. The isolation protocols still remain, but otherwise largely unaffected. The most people that have been affected actually are the ones that are supposed to go in for surgery, elective surgery, or otherwise, or get in for hospital admissions or travel, and have been testing themselves for, you know, with the RT-PCR test and found themselves to be positive. And so they do have a bit of a setback in their surgical plan as well as the travel plans, etc. So that's what's happening. Largely, we do have a COVID ward, of course, which is kind of full right now, but is largely inhabited by people who are like over the age of 70, you know, some kind of infirmity or the other, which is rather like a cardiopulmonary, either a lungs or a heart issue, which has made them quite infirm. And that's why they've been admitted more as a precaution, really, rather than a lung inflammation. Hardly in the last 2, 3, 4 months, in fact, have we seen COVID affecting lungs the way it was affecting lungs last year. So good news that way. Of course, the numbers have gone up, but that's, I mean, even then, I'm saying it's good news because the lungs are not getting affected. There's no deeper inflammation, no long-term problems, no infections requiring steroids, etc.
But do we know that whether this is the same strain as the last the December Jan Omicron, or is it something different?
So it looks like Omicron, but a small variation in the Omicron variant itself. It is not the B or the Delta, but it is definitely a variant of the Omicron itself. It's still a variation on it, which looks like it's even milder, probably a tad less infectious than the previous strain.
So my next question is that hence, will the various vaccines that one has taken, the boosters, you know, the cocktail, and all of that, will that suffice?
Yes, it will, because the cocktail will not. So it's been reasonably proven that the cocktail is not exactly effective against Omicron. So there is no reason to take the cocktail, the same casirivimab, imdivimab cocktail that we were giving earlier for the Omicron. There is a different monoclonal antibody injection which has been produced, but somehow we have not yet had that in India. So we don't have a medication as an antibody for Omicron variant at the moment. So if you have, so currently that is not practiced. The vaccines, on the other hand, are all against the spike protein, which seems to be quite common, whether it is Omicron or Delta or B variant or any other. It seems to be that the spike protein more or less stays about the same. So whether it is 50% efficacy, 70% efficacy, well, that's anyone's guess, and we can discuss. But the efficacy will be there. And in fact, the number of boosters that one takes, actually the efficacy does go up.
But we have seen that people who have taken two doses, did contract
Get the
virus,
the disease.
Omicron,
Yeah.
despite that. So in that sense.
So I'll explain that. So if you looked at the Delta variant or the Delta, the wave that happened, all those people who had been vaccinated with 1 or 2 doses by that time actually did very well. Like if you take a neck-to-neck comparison between those who were vaccinated and those who were not, there was a huge amount of difference. There was, obviously a life and death kind of a difference. Even now, the people who have taken the vaccine still will get the disease, because again, the vaccine doesn't prevent the virus from getting into the upper respiratory tract. It will still go ahead and inhabit the upper respiratory tract, cause inflammation over there, but no further. That's the real promise of the vaccine, is that it will not cause a deep disease, a morbid condition, death for sure. So these are the things that the vaccine is supposed to prevent. And so I think that much of the job it is doing. The spike protein vaccines do not promise to prevent the virus from getting into the upper respiratory tract. You cannot prevent an infection.
And what about the nasal vaccine that has been launched internationally, but it's not really come to India? Is that something that one should ask the cousin who's flying in from the US to bring along?
Actually, nasal vaccines have been, around for a while. I mean, even for influenza and for other illnesses. The problem with nasal vaccines is, as much as they seem like so convenient, you just have to spray them into the nose, and they should be able to incite a good amount of immunity. The localized the barriers that we already have, the natural immune barriers, seem to clear these vaccines so quickly that we don't really develop a good enough immunity. So the efficacy of these kind of vaccines is very poor, so as not to be render them quite useless. In fact, for larger scale use. So far we have not been able to break that barrier of the local immunity just kind of clearing away the virus, the vaccine product.
But is there other than the fact that one must be always masked up, which is of course easier said than done because people have gotten used to life without the mask. Is there anything else that you would like to advise, especially senior citizens who are here, what they should be doing?
So mostly the main important thing would be that anybody who is symptomatic should definitely stay away from other people. Try to isolate, wear a mask at all times. So that is the main, just like how we would, caution people when there's the flu going around. Symptomatic people stay away from other people, stay isolated. And those who are very vulnerable, for instance, who are elderly, yes, but most elderly people are not that vulnerable, especially if you're vaccinated and if you're taking some amount of precautions of keeping distance and masking at least indoors in a large gathering. Outdoors, I mean, again, masking I don't think is that important. There's good amount of air circulation. But indoors masking would be important. But anybody who's more vulnerable, who's just undergone some surgeries, on any kind of medical therapies like chemotherapies, etc., have renal problems, these kind of people, I would definitely say that it's a wave. It's going to peak in another 2 weeks and then settle down. Just these 2-3 weeks, probably kind of stay away from other people. It would be very helpful.
Doctor, you've used 3 words which I've caught on. One is you said that the growth has been exponential. The second thing that you mentioned was that the COVID ward is
full.
Is full up. And the third thing which you said is that it's going to peak in the next 2 weeks. Now, these things coming from an internal medicine specialist means a lot as such. So is that what it is? Is that reality that in 2 weeks it will peak?
Likely, because that's kind of how the Omicron virus has been behaving. Last time also, it was a very short run with a quick peak and a quick fall, with of course a much larger number of cases. But this time the case load is a bit less. At the same time, the virulence of the disease is also much less. Whether it is because we've all just had it in January and therefore it's kind of a natural booster that we've received, or it is because the virulence itself of the virus, the particular variant has come down. One can't 100% say, but it is definitely much less.
The fact that schools are shut and all of that does help. That you have kids who are not going to school, but
they are out in the playgrounds. There is no stopping them, including my kids who are currently there's.
All right, doctor. So friends, the subject of today's discussion is adult immunization. Though we did not intend to look at COVID, but when you have an internal medicine specialist like Dr. Hemalata Arora in the house, we couldn't not ask these questions. So, but over to you. The questions that you can ask is about adult immunizations that exist other than for COVID. If you have any questions, please ask them in the Q&A tab, as always, and mention your gender and your age so that Dr. Arora could give us a considered reply. Over to you.
Sure. I would like to make a small presentation which kind of lists a little bit about these vaccines, and we understand a little bit more about the vaccines that are available, what is the necessity to take them, etc. And then it'll probably be like 15-20 minutes, and then I'll be happy to take as many questions, including questions about COVID and COVID vaccines, no problem. Okay, so let's get started. So why do we want to vaccinate? Now, we all have understood, thanks to COVID and COVID vaccines, what a vaccine is. A vaccination is basically where we introduce a product which likely has something that resembles a viral or a bacterial material, which then incites immunity in the person, which then gives the person, the immune system, a bit of a memory, which then helps us fight the disease should we come across the disease in the future. So that really is what vaccination is all about. There, of course, it does come with certain amount of side effects and effects, after effects, etc., which we can always discuss. Again, in terms of the larger good of the vaccine, the side effects are very, 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 very minimal, so as to be almost negligible. It does prevent disease in certain times, like for instance, in certain of the vaccines like hepatitis B, shingles, which we will come to, it prevents the disease, or it reduces the effects like we have seen with COVID and with other pneumonia vaccines, etc. It can reduce the effects much significantly. It also causes what is called herd immunity. Herd immunity is a great concept. Basically, what it means is that, let us say we have a building full of people, and we've decided to vaccinate or do something specific to all of them, and only about maybe 60% or 70% of them participate. So what's happening? Does that mean that the 30% people or 20% people who are not participating are going to get the disease? Actually not. It's because of the 60-70% people who are participating, it gives enough immunity that when the virus or any particular bacteria is bouncing off around people, it kind of stops itself short in the people that have been vaccinated. So which means that because at least more than 50-60% people have been vaccinated, most of the people, none of the people will actually get a disease. That is the real meaning of herd immunity, basically, which means that even if there are 15-20% people who are left out of the vaccination pool, the disease can still be eradicated, or disease can still be stopped short. Vaccination is extremely important, as we've seen in the last 100 years, where we have seen eradication of diseases like smallpox, mostly eradicated measles, and from India, I think largely eradicated polio. So these have come with great effort from both the public and the private fronts. Louis Pasteur famously has said, when meditating over a disease, I never look to finding a remedy, but instead look to finding a means of preventing it. And that I think is a lot of what infectious disease specializations is all about, mostly about finding preventions rather than cures, because sometimes the cures can be harder than the disease itself, even sometimes. So there are multiple vaccine preventable diseases that we know of at the moment. The list is almost up to 25 to 30 diseases. COVID has become added to this particular list of conditions. A lot of them are quite common if you just kind of glance through the list. Some of them are a little bit more obscure, like your yellow fever and Japanese encephalitis, tick-borne encephalitis, etc. But the more common ones like diphtheria, your hepatitis B, pneumonia, typhoid, all of these are also vaccine preventable. Whether we knew that they were or not, that's a separate issue, but they are all vaccine preventable. So why does, again, a lot of us get immunized, and in fact probably all of us, even whatever age we may be, probably all were immunized as children. So why is it that that's not enough? Why do we have to vaccinate again and again and again? So thing is that our immune system, while working very well in terms of preventing illnesses, also treats a vaccine as a outside foreign object. So which means that any vaccination received in childhood is not going to give us a lifetime immunity, because it slowly the immune system not only forgets, because it's a foreign object which it had seen a long time ago, and it also kind of clears it out. So from our memory, from your immune memory. So we need to sometimes get repeat vaccinations, like for tetanus and hepatitis, etc. Some adults which we have actually escaped the vaccination as children because they just simply were not situated in the same community where vaccinations were given, or whatever else the reasons may be. Now there are also new vaccines that are available. Newer, maybe the earlier ones were not as effective. Plus there are newer diseases for which vaccines have been provided, like typhoid is a newer vaccine. Chickenpox, there are newer vaccines which happened in the last 10, 15 years. As we age, once we cross the age of 50, 55, 60, 65, our immune systems are slightly different. What might not have caused a great amount of disease, like for instance, influenza or pneumonia in the under 40 age group or 45 age group, as we grow older, we tend to have much more consequences of having contracted that particular illness. So it's also important that the elder age group be more protected with these newer vaccines, different vaccines. So these are the reasons why we want to give vaccines as we go along, age-specific vaccines, more for the infirm and the elderly also. There's various examples. This is just a slide to kind of showcase various examples of various morbidities and mortalities in the recent years in the Western world, in the modern first world, if you can call it that, where things like pneumonia, influenza, hepatitis, etc., have caused tetanus, have been causing deaths. Now we will talk a little bit briefly about the individual vaccines, and I will just go through them, reasonably quickly, so we can stop and discuss it in a more of a question-answer interactive basis. Now, the first one we'll talk about is the diphtheria pertussis tetanus. Now, everyone has heard about the DPT vaccine, which we take as we are children, which we give to our babies. They're literally given when they're 1.5 months old, and they're given about 3-4 doses, and they're considered to be vaccinated. However, by the time we get to be 18, 20, 25 years old, our immunity to these diseases starts to wane. So if you have not already taken, most people have not, and adult vaccination in our country is largely neglected. So most people have not taken a repeat booster of this as an adult. Now, again, same pertussis, which is the whooping cough, if occurring in an older person, or diphtheria occurring in an older person, can have more graver consequences than in a person who's 35, 40. So I would really recommend, if they've not been vaccinated recently, or a booster has not been taken, to go ahead and take one booster, and that's all that is required. The hepatitis A vaccine on the hepatitis A disease. Now, it's not very common, especially if you're more over the age of 65. It's far, far more likely if you're born and brought up in India that you would have had the hepatitis A at some point, at some level, and you'd have immune antibodies to it. But however, if there is anybody who has liver problems or kidney problems or any other infection, any other infirmities like chronic disease who are going to be on dialysis, they would really benefit from taking the vaccine anyway. There is a couple of kinds of vaccines, and there's also one vaccine called the twin Rix, which I've put here in the middle. That is important because it gives you both the hepatitis A and the hepatitis B vaccine together, with a good convenient dosing schedule of 0 months, 1 month, and 6 months. Hepatitis B vaccine, on the other hand, needs a little bit more consideration. It is a little bit more important because we do have a lot of chronic liver disease because of hepatitis B. Again, it is not necessary for all people over the age of 60 or 65 to take it. It is far more important for people who are in the healthcare business, or who are, there's some kind of exposure, or who already have a liver disease, already have kidney disease and need to undergo dialysis. So these are the people who would far more benefit from having, who have, constant healthcare touch points, would also require a hepatitis B vaccine. One more specific important population is the diabetics. Now, while diabetes doesn't look like, the diabetics doesn't mean that you have liver disease, but currently, leaving more than alcohol, it is diabetes that is the largest cause of fatty liver disease, and fatty liver disease leads to cirrhosis. So more than alcohol, it's fatty liver that is causing cirrhosis, and people with fatty liver, most diabetics end up with fatty liver, and people with fatty liver do benefit from taking a hepatitis B vaccine, because then that will prevent any other, the hepatitis B virus from infecting them, and therefore you will not have the extra morbidity of that affecting the liver. So hepatitis B vaccine, and of course it is probably in the world one of the most effective vaccines. After one has completed the 3 doses, there's a 95% or more efficacy, which is more than can be said for pretty much any other vaccine that has so far been invented. Now, the next 2 vaccines, which will be the influenza and the pneumonia vaccine, are probably the most important of our today's discussion, considering that they are the ones that are to be taken almost, absolutely in a compulsory way. Now, the influenza vaccine prevents influenza. It is an annual vaccine, which means that it has to be taken every year. The reason for this being that the influenza virus, it is an ever-changing virus. From year to year, you can get different strains. And so the scientific community is on top of it, making sure that they're kind of isolating which strain is going on in this particular year, or the previous year, or the next year, and making sure that we are updating our vaccines accordingly. So most of these, all of these vaccines are inactivated. It just to be taken 1 dose per year. Now, normally in most of the Western world, and in fact, most of the world, they take it just before the winter. In Bombay, however, I and a lot of my colleagues practice to give it just before the monsoon. So around this time, or a little bit even a week or 2 ahead of now, before now, would be the right time to give this vaccine, because in Bombay, we have 2 peaks of influenza. One is during this 3 month of long, monsoon season, as well as later on in the month of November, December, January. So since we have 2 peaks, and the validity, like the efficacy of the vaccine lasts for about 8 to 10 months, we prefer to give it at this time so it can cover both of these peak periods of influenza season. It has also been very important ever since the advent of COVID, because a lot of times we can have influenza and COVID come in together as a combination of both of the diseases happening at the same time. So if we are already vaccinated with influenza, it means that even if we do have COVID, which is far more likely considering it's a newer disease and it spreads much more easier, at least the flu part we are protected from. Therefore, our illness will be much muted. Similar thing with pneumonia. If we have influenza, we are far more likely for it to develop into pneumonia. So if you prevent the influenza itself, a lot of pneumonia can be prevented. Of course, pneumonia vaccine is a separate consideration, and we will talk about it. But taking the flu vaccine and preventing flu, which again, it's not absolutely completely effective. It's not like it will prevent it 100%. Something around maybe 70 to 80% is what its efficacy is. And if we're able to do even that much, we will be able to prevent a lot of pneumonia cases, especially in the older people. Now we'll talk about the pneumonia vaccines. Why are the vaccines for pneumonia important? Now, when people have, what does pneumonia cause? It causes pretty serious lung disease to land people up in the ICU, can cause sepsis, which is a very common cause of the final cause of mortality in a lot of older people, especially who have other underlying conditions like diabetes, heart problems, lung problems, kidney problems, any kind of cancers. So most of these people, they don't die of that particular ailment. Mostly they develop a pneumonia and then they go into sepsis, and that's how the demise happens. This can largely be prevented by the influenza and, of course, the pneumonia vaccines. So anybody who has underlying lung conditions, asthma, even if they're younger than the age of 60, 65, should be taking pneumonia vaccines. And there are certain little nuances about the pneumonia vaccine, and I won't go into details, but at the same time, I just want to make you aware that there are two very different kinds of pneumonia vaccines. One is called the conjugate vaccine, or the Prevnar 13 is the most famous one. And one is the polyvalent vaccine called the Pneumovax 23. So there are two different vaccines, and a little bit on rules about the vaccines. Most people can take either vaccine and they give good protection. But if you take both and in a particular way that is supposed to be done, then you have a far better protection. Because taking just one vaccine under the age of 65 or over the age of 65 gives about 60 to 70% protection against pneumonia, probably around somewhere around 60, 65%. But if you're able to take the conjugate vaccine followed by the polysaccharide vaccine in the correct manner, then it actually, that protection increases up to 75 to 80, 85%. So that is a very good number to jump up with just this precaution of taking two vaccines in the correct way possible. Measles, mumps, and rubella is the next vaccine to consider. Again, not so predominant in the elderly age group. More important for, let us say, the young adults and who need an extra level of protection after the initial immunization as children. Shingles. This is another very, very important vaccine for older people, especially over the age of 50. Now, if we have had chickenpox, which a lot of us have had, or even have not had chickenpox but been vaccinated against it, but the vaccination has kind of waned out. So what happens really is the chickenpox virus has gotten into us. We have, had the whole, the pustules and all of that, the rash, and we've kind of gotten over it. It's but taken a week. That was many, many years ago, many years ago. But having said that, the chickenpox virus has not left the body. It goes and sits in the spine, in the back, on what is called the dorsal root ganglion. There is a small space where the nerves are all collected. There's the roots of the nerves are all collected, and that's where the nerves branch out from. It sits over there and remains there and remains there and remains completely dormant until at a certain point in our lives, our immunity starts to wane. Now, what do you mean by immunity starting to wane? You could have a new inflammatory condition. It could even be COVID. You could be taking medications like steroids, which reduce your immunity, or any other reason, or just simply age can cause our immunity to wane down. And then this particular virus then tracks down that particular nerve and goes, as you can see, it is tracking down this particular nerve from here to here. This is what is called the dermatome of that particular nerve. That nerve supplies this area, and that's why the rash comes in this particular fashion. But this is pretty much chickenpox of that area. So that virus has spread and caused the same things in that particular area. It is as infective as chickenpox. So somebody who has never had chickenpox comes in contact with this person will probably get chickenpox. There is a pretty reasonable lifetime risk of 30% of getting shingles, and it increases with age, especially over the age of 50. Now, if it was just another one week illness which had with the rash and it goes away, it would still be fine. But there is one particular condition called post-herpetic neuralgia, basically, which means that that particular nerve continues to keep being hurtful and painful. That particular nerve area continues to be hurtful and painful for some weeks and sometimes months together, which can be quite debilitating. So it's always very, and then something like this can happen repeatedly. So it's really a very important vaccine, more from a preventing debility, preventing this kind of recurrent pain from happening. There are two kinds of these vaccines. Until now in India, we just had the Zostavax, which was a kind of a live attenuated vaccine, which you cannot give to people who are immunosuppressed. But at the same time now, it was a single dose vaccine, around 70 to 75% effective. But now we have the Zoster vaccine recombinant, which is a new Shingrix vaccine, which is available now for use in India also. And this one has to be taken in 2 doses. However, it is far more effective and prevents the shingles disease from happening almost maybe around 85 to 90%, 90-95% of the time. So this is a far more effective vaccine, but 2 doses. This one is a single dose vaccine, not as effective, a little bit older, cannot be given to people who are immunosuppressed. So the 2 different kinds of shingles vaccine, very, very important in the older age group, in fact, over the age of 50. Typhoid, the last vaccine that I want to consider before we start taking questions is the typhoid vaccine. Now, this is not a viral vaccine. So far, we've seen all of these viral vaccines except for the pneumonia vaccine. Again, this is a bacterial vaccine. Bacterial vaccines are typically difficult to make. So, but then there are certain vaccines which can be used, and especially they can last for a few years at least. The protection can last for a few years. So typhoid vaccine is one such vaccine. There are a few different kinds of vaccines, the conjugate vaccines, the oral vaccine, and the capsular polysaccharide vaccine. The one that we're using the most right now is the conjugate vaccines, made in fact by India. India is the pioneer in making these typhoid conjugate vaccines. The rest of the country still uses the capsular polysaccharide and the oral vaccines, and usually it's more cumbersome to give the oral vaccine if you take multiple doses, and you need to, the immunity also lasts not so very long, and the efficacy is not that great. But the typhoid conjugate vaccines have been made by both Bharat Biotech and the biological E companies, and they are a single dose vaccine, and they seem to have a reasonable protection. Well, 2 years is what is listed here, but as of now, it's been about 4 to 5 years since the vaccines have started, and studies have suggested that you do not need any further vaccinations, and the efficacy is much higher. So currently now we are using mostly the typhoid conjugate vaccines in most people. So the CDC does have this particular app which gives you the vaccine schedules. It's the CDC vaccine schedule app. So if you're tech savvy and you feel like reading a little bit about it and understanding, so you can go to the doctor with the right questions, this is a very nice resource to kind of read about what are the various vaccines that you need to even look out for. So I'm going to take good advice and say, keep reminding the patients that a short period of discomfort is a whole lot better than a visit to the ICU. That would be my advice to everybody. And thank you so much for listening. I'm really happy to take any number of questions.
Thank you very much, Dr. Hemalata, for this excellent session. I'm sure there are quite a few questions that are coming. There are a few questions that are coming to me by SMS as well. Can I get to the questions right away?
Yes, please. I mean, would you like me to read them, or would you be?
There's just one question which I would like you to read. Perhaps you could start with that, because it's a slightly longish question. This is
Sridhar Srivastav's question, yes?
Right. So it's not a question which is on vaccination, on immunization, but looks like a important thing. And so his question is, as you're reading it, I'm on the following medication since 2002, Thyronorm 75, Nevistar, CTD, Atofit. I had undergone angiogram in August 21, and there were no adverse changes as compared to the report of 2003, and I'm undergoing medical treatment. For the last 3 years, I'm experiencing warmth in the whole body, from the sole of the feet to extending to the abdomen, chest, throat, iris, etc. I'm unable to identify what trigger it is. All the vitals are fine. Who do I
Okay.
speak to.
It would be great to know how old this person is, but even otherwise, a lot of times I see these kind of changes happening in people who have some of the other vitamin deficiencies. As we continue to grow older, we end up having some of the other vitamin deficiencies. I would be very I'd be very happy to understand if we could do any tests which require, which can determine vitamin deficiency. I think that would be the most helpful in this particular condition, because the symptomatology doesn't sound like it's a cardiac or a neurological, or a gastrointestinal problem. It sounds more like a slight neurological problem, but at the same time, that might be because of these deficiencies that can very easily happen.
Right. Thank you. Doctor, there are a few more questions which are similar in nature, but I'll go to the immunization bit and then get to the other. This is a question from Rich Dugal, who asks, where do we get these vaccines in small cities? I'm 78 and male. He's not mentioned where he's from, but are these available in small cities?
Yes. At least the influenza, pneumonia. The only vaccine that I would have a little bit of a doubt about being available is the Shingrix vaccine, which is the newer shingles vaccine. That has just come in as of like a couple of months ago. So that might be a little bit tough to get in smaller cities, but at the same time, there are various resources. It is brought in by GSK, the GlaxoSmithKline company, and their representative would be happy to assist any doctors that are there in whichever smaller or bigger cities to be able to acquire them. The rest of the vaccines are very easily available in almost everybody. There are several associates in smaller cities in the states of Jharkhand and West Bengal and all of those places where they have been giving these vaccines quite regularly.
Right. Thank you. There's Mr. Malcolm Manchero, who's 69. He says, very good presentation. He says, kindly summarize what vaccine should be mandated. I have no comorbidity. So before you answer this question, the edited video of this session will be on the Seniors Today website, as well as a takeaway. So you can watch it again and go through the entire presentation. That will have details of the various vaccinations that are available and that doctors mentioned. But yes, is there any checklist kind of a thing that is available?
Yes, in fact, I'd like to make it really easy. So at this age with no comorbidities, I would say the influenza, the pneumonia, and the shingles vaccine are a no-brainer. If you tend to eat out a lot, travel a lot, the typhoid, especially in India and Southeast Asia, typhoid vaccine should be added to the list. So these are the 4 vaccines that are absolutely, they're no-brainers. So you can go ahead and right away take them without, thinking about it. Then other vaccines I would have mentioned, like the hepatitis and all of that, probably you need to discuss it with the doctor. But you probably, if you have no comorbidities and no other risk factors, you can avoid those. But these vaccines can be taken.
Doctor, can the influenza vaccine and Prevena be given together?
Yes, they can be given together. And I would like to say a couple of words about vaccines being taken together and separately. So most vaccines can be given together on one day. But if you have taken a vaccine today, in the next 2 weeks, it is preferable not to take another vaccine. So this vaccine's immunogenicity started to work, then we do not want the body to be confused with another vaccine in the next few days. The same day, it's fine, because then both of the immunogenicity start working together. So influenza, and if anything about the children being vaccinated, we give them a 5 different kind of vaccine dose at once, usually. And as long as it is given at the same time, that's fine. But if you've given it today, then next 2 weeks, we don't want to give a different vaccine. After 2 weeks, again, we can give any other vaccine we choose to give.
Thank you. Doctor, there's a question that has come in to me saying that vaccines are very expensive. How do senior citizens like us manage?
That is true. I have to say that is true. There are the vaccines, because honestly, I have to say the vaccines which are used for adults, which is the flu and the pneumonia vaccines and the shingles vaccines, they are expensive. And I think the reason they're expensive is that because they're not that many takers. If there are if it is used in a far more widespread way, I do feel confident that the vaccine cost will come down significantly. So, like for instance, if you look at the hepatitis B vaccine, about 20 years ago when I was training, it was costing something like at that time, 20 years ago, 600, 700 rupees, which is quite a bit for 20 years ago. And now it is like 50 rupees or less, in fact. So because it has become much more widespread use, it has taken some time. So any new product obviously takes a bit of time to get to get less expensive because of all of the R&D cost that goes into it, etc. But more than that, I think these vaccines will become cheaper the more we use them. So at the moment, yes, they are a little bit expensive. There are certain programs, I think, in the government organization, government hospitals, which do provide some of these vaccines, but not all. Not all.
Thank you. We have a question from Kashi Viswanathan, who's 74. His question is, he says, probably had childhood smallpox vaccination, got 3 COVID vaccinations, no other vaccinations. Is shingles or herpes contagious? Any precautions recommended to take during a social get-together in which an infected person could be attending?
Yes, shingles and shingles or herpes zoster is very, very contagious. It is as contagious as having a person with chickenpox. A child with chickenpox, generally we do not allow into a social gathering because otherwise everybody else in that gathering will get the same disease. So shingles is as contagious as chickenpox. Somebody who has shingles is required to stay at home for 7 days until the last of those lesions are crusting and falling off. Sometimes even for a couple of days more. They are very contagious. Regarding the vaccines, again, like I just mentioned, those are the vaccines that you can just take, you can directly take without much consideration: the flu, pneumonia, shingles, and probably the typhoid vaccine if you tend to go out a lot.
Right. Doctor, there's a question that has been asked that this is not for myself, but for my son who is 30 and who's not had chickenpox so far. And I don't think he has taken a vaccine either. My 2 questions are, how do I know? I don't remember whether I've given him a vaccine or not. And second is, what does one do now? Can one take a vaccine now?
Yes. So if your son is 30, it is unlikely that you have given him the vaccine because the chickenpox vaccine started to become used in the universal immunization program for children only in the last 12 to 13 years. So before that, it was not being used. So which means you probably have not vaccinated your son. And it is a good idea to go ahead and take the vaccine. There's a chickenpox vaccine, which is apart from the shingles vaccine, which is available, which is much less, the potency that is required for the shingles vaccine is much higher than for the chickenpox vaccine. And it is taken also in 2 doses about a month apart, easily available and should be taken.
But how does he know whether it had been administered? Just in case it had been.
So most of the time, first of all, even if you were administered and even if he did have, or even if he did have actual chickenpox, taking another vaccine dose does not hurt. It does not hurt at all. It is just taking the 2 injections, nothing more than that. Having said that, one can always check. Any viral illness typically has IgG antibodies, and now we've gotten used to understanding COVID antibodies and all of that. So we understand antibodies have a huge role in immunity and memory of immunity. So IgG antibody tests are available for most of these illnesses: hepatitis, chickenpox, your measles, mumps, rubella, all of these. And we have the tests available for that, where we can check the immunity that is already present. So the antibody levels will suggest, the titers will suggest whether we have immunity or not. Just like with COVID, when we take vaccine, we're checking vaccine antibodies to see what the titers are like. We are less clear about COVID, but far more clear about these other illnesses, about what titers are good enough for saying that you are immune.
Doctor, you just mentioned about the test to determine the antibodies. So is there a test that you would recommend people to take just to check?
So it is not, it is vaccine specific. It is virus specific. So if you're checking for for chickenpox, you will test for what is called varicella. That is the name of the virus that causes chickenpox. You will be testing for that particular one. If you're testing for measles, mumps, and rubella, you'll be checking for each one separately. So there is no one test which will say, yes, you're vaccinated to this, and this. You have to take a blood test for each one separately. I mean, the blood draw is one, but the tests are all separate.
That's quite a bit then. Okay, we have a question from someone whose name is not there, but he's 75. He's taken 2 doses of COVID and a booster dose in January this year. His question is whether, 1 year later, there will be another booster dose required.
Most likely, because it seems like the COVID, the vaccine effect is not super long lasting, at least so far. Whether it is because of the slight changes in the variants, or just because the vaccine immunity simply comes down, it is not seeming to last very long, at least so far. Now, having said that, most viral diseases usually require a booster. Like even hepatitis B, which is the most effective vaccine the world has made so far, also requires 2 vaccines and a booster 12 months later. After the booster, after the 3 vaccines are done, then the chances of contracting hepatitis B are practically nil. But with COVID, it may be that we may need 1 or 2 boosters, after which maybe our immunity will be strong enough. So far, we still have to see that. I mean, we don't know as of now.
There's a question about the shingles, the new virus, the new vaccine that you mentioned. Has it been adequately tested?
Yes, very much. It has been around in the Western world for a long time, for more than 4, 5, 7 years, and has been adequately tested, seem to be safer and much more efficacious than, and again, made with technology which does not have a live virus in it. It is made with recombinant DNA technology, which is again the technology which is used to make a lot of the different kinds of vaccines. So it is seen as very efficacious, very safe. Does require 2 doses, one initial and then a second to complete the course.
And which can be taken in 2 different cities or?
Yes, that's the same thing. Shingrix is pretty much the same brand across the world. It's made by one company, and maybe we'll have different brands also. But even if you have a brand interchangeability, that should not be an issue.
Doctor, there's a question from Somesh Java, who's asked, who says, we were in the US last year and got ourselves vaccinated with Pfizer shots for COVID. Now it's been a year and are back in India. We really don't know what booster dose to take. We can't go back to the US as our visa has expired, and we've got a date of October 22. Please suggest what vaccine booster dose we can safely take.
Okay, so currently your choices are 3: the Covaxin, the Covishield, and the Corbevax and Covovax. So Covovax is mostly, been given to younger children, so that's not there. Corbevax, which is made by Biological E company, which has just been approved for the mix and match vaccination. That will probably be the best bet at the moment because that is a subunit vaccine. Having said that, both Covaxin and Covishield, when used in a mix and match technique, would be just as effective. So 2 Pfizers, and then the third can be any of these 3, whichever is easiest available: Covaxin, Covishield, or Corbevax.
Doctor, there's an interesting question. I have taken a booster, and since you mentioned about the mix and match vaccine, can I just take it informally?
Not to my knowledge. There are several ways of getting it informally, but I am sorry, I am not privy to that, and I'm not able to, really supply that from my end. Informally, if you are able to get it, so again, the advice remains the same. How you get the vaccine is a different point. But at the same time, if you need a certificate, again, this has been something which has been discussed often, so I'm just putting it out there. If you need a certificate for travel, that the booster is required, etc., it just becomes easier if you take it more formally.
No, but so the question is, as I can figure, this person said, is that one has taken 3 boosters, and now one knows that this vaccine is available, and it's a good thing to have. So can you just, go and get one?
According to the COVID app, most likely not. But you should be able to get it more informally, yes. And going ahead and taking it is not harmful because we have taken probably the Covishield kind of a vaccine run, and taking a Corbevax, which is a different or a subunit vaccine, might just actually be more useful. Having said that, let us also understand that the COVID-19 infection has waned down quite a bit. So, we may want to wait for taking the boosters maybe for another few months to see how the disease behaves. We've had another wave after, say, about 6 months, which has been largely muted so far. Yes, the cases are going up, but the infection virulence as well as the infectivity has been much less. Virulence especially has been quite less. So if you've taken 3 boosters, it's likely that the last booster was say about 6 months ago. You can go ahead and take another booster. It is, and probably will become readily and easily available within the next few months.
Right. Thank you, Doctor. We are far exceeding time, but there are so many questions. I'll just ask a few of them. This is from Sumer Jain, who's 80 years old. Says, how much time does it take for conjugate pneumonia vaccine for being effective? I've been an acute patient of asthma. Hope this is best for me.
Yes, it is best for you. In fact, you should take the influenza and the pneumonia together. It is effective within a month of its being taken.
Right. And there's Brigadier Kalia who asked, what is CMV infection? What are the noticeable symptoms if one is infected?
Okay, CMV infection is actually a very low-key infection. In normal people who have normal immunity, even if we have CMV infection, we don't show any symptoms. It is sometimes it's just there and it doesn't really affect us much. In people who have low immunity, it can cause various concerns. It can cause brain, meningitis. It can cause blood problems. It can cause fevers, even as bad a thing as sepsis, lung infections. It can cause various things, but usually only in people who are immunocompromised, not people who are have normal immunity. Just one moment, please. Yeah, so the most likely thing is that you will not have any symptoms of CMV infection. You will be able to fight. The body just kind of accepts the infection and keeps it to a low enough level. It's only people who are either on chemotherapy or on steroids or have any other kind of immunocompromising reason that can have a pretty serious infection. Then it becomes so serious that one has to really investigate and take care of it. It's a treatable condition with antiviral medication.
Doctor, there's one last question which I have, which is not concerning vaccination, but this is from RC Goel, age 69. He says, no major illness except BP, and I take Amtas 80 in the mornings and Telma 40 at night for over 10 years. And BP is normal. His query is that I feel tiredness in my body all the time and feel slight pain in different parts. Sometimes I get cramps in my hands and after doing some physical work, and cramps in my legs while sleeping. Whereas I do my walk in the morning for about 40 to 60 minutes and in the evening for 35 to 45 minutes. And I'm doing it comfortably and do all my activities as well. Can you advise what the problem is? He is 69.
So these, if very young to have like this kind of severity of cramps, but at the same time, these kind of cramps are much more common in younger, after the age of 40, 45 in a lot of women. Now, there are 2-3 reasons why this kind of stiffness and cramps set in. One is not enough stretching. So your flexibility, one can improve. Second is a little bit of hydration issues. And third is vitamin deficiencies, vitamin, iron, especially if the legs are cramping a lot during the nights, iron needs to be looked at, and sometimes vitamins need to be looked at. Vitamin D also can be a reason for why leg cramps and stiffness in joints happens a lot more often. And these days we have enough people who have vitamin D of really abysmally low levels. Something which is near normal will not affect anything, but it's something which is less than 3, that kind of level can cause these kind of cramps. So there are various things to be looked into.
Great. Thank you very much, Dr. Hemalata Arora, for this session. Very informative, and we've taken over 25 questions, and I guess the from the feedback that we have here also, it has been found very informative. So thank you very much once again. And to all of you here, we will be back once again with next Saturday at 5 p.m. with the next session of Health Live at Seniors Today. Remember, the next issue of Seniors Today magazine is going to be out on the 15th. And this time, the cover story is by Dr. Eric Borges, who has been here in these sessions. And he's going to be talking about heart care for senior citizens. As an aside, we also have some interesting heart songs that you can sing. But that apart, that's what it is. As you are aware, Seniors Have Talent. The 8th season is going to be is going to start from August. In a couple of months from now. So if you would like to participate, or if there's anybody else who you think should be participating, please ask them to register, and we will get in touch with them. Thank you very much once again, Dr. Hemalata Arora, for this session.
Thank you very much.
Thank you very much.
Subscribe now and press the bell icon. Never miss an update.